Hi, folks. My name is Alyssa Green, and I'm the Outreach and Education Manager at Georgians for a Healthy Future. Today, we're going to be going over a lot of helpful information, but first, I want to talk a bit about Georgians for a Healthy Future. So, we are a consumer advocacy organization. We were founded 10 years ago, and we work in several different ways. One way is by directly engaging with policymakers. So, during the legislative session, we're really active at the Capitol, speaking directly with our legislators and informing them of different healthcare needs in Georgia. We also make it a point to connect consumers around the state. A large part of my position is going around the state and collecting healthcare stories from consumers so we can get a really complete view of what Georgia consumers are facing. Another way we do this work is engaging in coalition mobilization. So we have partners throughout the state of Georgia, and we meet fairly often to talk about different issues, healthcare issues in the state of Georgia, think about ways we can connect, and ultimately build healthier communities here. And so, speaking of building healthier communities, we're going to be talking a lot about that today. A few different things we're going to be going over includes pathway to healthcare coverage, so thinking about how people in Georgia access healthcare coverage and why that's important. We're going to be talking about who Medicaid supports, what the Medicaid program is. We're going to be talking about why Medicaid makes economic sense for the state of Georgia, next steps for Medicaid, and finally we're going to talk a bit about becoming a health advocate. And so to get started, I want you to think about some ways that people in Georgia have access to health insurance. Maybe personally or through your own work, maybe you can brainstorm some ways you think that folks are able to access health insurance. Okay. So there are several different ways that people can gain coverage. So we have job-based coverage. That means when someone is employed by an organization, that organization is providing access to healthcare for that individual. We also have individual and non-group healthcare coverage. So we think about the healthcare.gov website where folks can go and they can look at the different plans available in their state and think about how many services they need, what kind of services those are, and really kind of tailor those plans to their needs. Then we have public health insurance coverage. So that includes Medicare, which we won't be covering today, but that is a program that supports seniors and some folks living with disabilities. We have TRICARE that supports veterans, Peach Care, which is a form of Medicaid, and finally Medicaid, which we're going to be talking a lot about today. These are the different ways that folks can gain access to coverage. And so why is this important, right? Why are we here advocating for the Medicaid program? Well, there are several important reasons. Medicaid health insurance ultimately saves folks money. So we think about the uninsured costs. That's $900 per person in uncompensated care costs. So local hospitals, and just to brief everyone on the state of Georgia, there's been quite a few rural hospital closures, and we can prevent this by ensuring that folks have access to health care. It does improve physical health, so more preventive care, more folks experiencing excellent rates of health, and then also reduce mortality rates as well. And this is really interesting to note that health insurance also improves financial health of individuals. So we think about when folks have access to health insurance companies are paying for those services for folks to ensure that they're healthy and everything's not coming out of the consumer's pocket, right? So that means that they have more funds to pay for their other needs and are less likely to go into debt. And it's interesting to note that nearly twice as many people without health insurance have medical bills or debt compared to people with health insurance. So we see that folks that have health insurance are indeed financially more well off than others. And so what does that mean for Georgia? Medicaid plays a really significant role in the health of people here in our state. 1 in 5 of all Georgians are covered by the Medicaid program. And what's really important to note is 1 in 2 of all children in Georgia. So that's half of the children in the state are covered by the Medicaid program. So we see the importance of the Medicaid program, especially when it comes to folks under the age of 18 and providing those really important services to ensure that we have healthy children here in our state. And also 1 in 5 poor adults in Georgia are covered by the Medicaid program. So we think about low-income folks and ensuring that they are also covered. The Medicaid is significant in that as well. Who gets Medicaid in Georgia? This is a big question I get when I do story collection around the state. Folks want to know what the eligibility requirements are, and we have them right here. So we see that the largest population covered by Medicaid is children, and that's through Peach Care that builds on top of Medicaid for children. Then we have pregnant women that can also receive Medicaid. Nursing home and community care. So we have lots of elderly folks and folks aging in place that are also able to take advantage of the Medicaid program. Folks that have been diagnosed with breast or cervical cancer are also eligible to receive Medicaid. People living with disabilities, folks who are also elderly, and then finally low-income parents. And I want to make a note that these requirements are based on federal poverty line, and that does change annually. So right now, for an individual who falls into these eligibility requirements to be eligible for the Medicaid program would have to earn about $12,140 a year, and then for a couple, that's at $16,460. So I do have a lot of conversations about income requirements, and we'll also dive into that a little bit more later, but these are the folks who are able to take advantage of the Medicaid program and are eligible. So right now, GHF is based in Fulton County in Atlanta, and so I wanted to look at the county and see what Medicaid looks like for the county where we're at right now. So in our county, there's 147,562 people currently on Medicaid. And just like we talked about children being a large majority of folks on Medicaid, that's true in Fulton County as well, with over 82,000 children in our county alone on Medicaid, and with over 15,000 of those folks on the people on Medicaid being elderly. We have 135,000 people here in the county that don't have insurance. But I also want you to pay attention to the fact that over 69,000 of those people who don't have insurance are also employed, right? So we see, I meet a lot of folks out around the state as I'm doing story collection that are employed full-time or working more than full-time, right? And they're still not able to access health insurance. And then finally, I wanted to point out that over 14,000 of the uninsured here in Fulton County are children, right? And children are always able to receive health insurance. So it's definitely important to note. So what does it mean when folks are working and they're still not able to receive health insurance? That's what we call the creation of the coverage gap. And so under the ACA, states are allowed to expand their eligibility up to 138% of the federal poverty line. And that has not happened in the state of Georgia up until this point. And what that means is the Georgia legislature, along with the Georgia governor, have not come together to agree to expand Medicaid here in our state. So we have folks who are able to access the healthcare.gov website and pick those personal plans. And then we have folks who are able to get on the public plans like Medicaid. But those folks who don't make enough money to go through healthcare.gov and make too much money or don't fall into the specific eligibility requirements for Medicaid or other public health insurance are in that coverage gap. Not making enough and making too much at the same time. And that's how we end up with about 240,000 people here in our state alone that could have health insurance coverage if we expanded Medicaid, but don't at this point because that has not happened in the state of Georgia. So there's a kind of a graphic to explain this gap that happens, right? So we have folks who have Medicaid coverage right now. We have folks that are able to access health insurance through the marketplace, but then we have lots of veterans, working parents, low-wage workers, et cetera, that fall into that coverage gap, who don't make enough money to get those tax credits on the healthcare.gov site, but also make too much to qualify for Medicaid. And it's important to talk about who is in the coverage gap, right? What are these folks? Who are they? What do they do? And again, a part of my job is talking directly to these people that are in the coverage gap right now. We see that currently it's tied pretty closely with racial demographics between white and black folks, with white people at 37 and black folks at 36. We see a larger amount, a smaller amount of Hispanic folks in the coverage gap at 22%. But it's also important to note that the largest demographic in the coverage gap at 60% are people or young adults, folks under the age of 40, right? And these people work across multiple sectors: construction, food service, education, retail, our grocery stores, trucking, etc. And these are really important industries, right? We think about folks who are taking care of our children while we're at work, people who are educating our children, folks who are paving our roadways, delivering our goods across the state, right? These folks are doing really important work to support our communities and are still not able to access health insurance because they are stuck in the coverage gap. I wanted to include some personal accounts of coverage gap stories. I had the privilege of going to Disability Link earlier in the spring, and I sat down with two employees there at Disability Link, which is an organization that works to support people living with disabilities, and I talked to some of their employees that didn't have health coverage. So we see first Darnell. He was someone, a middle-aged man. He's a manager that works there and is the face of the organization when folks walk in, and helps connect people living with disabilities to community-based resources. He has not been able to receive any type of annual screenings. It's been years since he's been able to go to the doctor, and he does have some health concerns that he's not been able to get checked out because of that lack of insurance. And then we have Deborah here as well, who's an employee. She goes through the AARP program, and because the program only pays minimum wage, which is $7.25 an hour, she's not able to make enough money to go through the healthcare.gov website and purchase health insurance, and also doesn't fall into the income requirements for Medicaid as well. So this is an example of two folks who are working, who are connecting people to community resources, who are doing very valuable work and still cannot have access to health insurance and get the services that they need. Okay, so Medicaid goes by several different names. There's several different programs that work under the Medicaid program to provide services to folks in communities. So what's your think? What are some other names for Medicaid? What have you heard Medicaid referred to before, maybe in your work, or maybe you've signed up for some different programs? What are the name of some of those programs? Well, there's several different programs. We have AmeriGroup, Care Source, and WellCare that's mostly for low-income parents. Then we have Peach State and Care for Kids. That's for children. And then Georgia Families 360 covers children in the foster care system, and the Katie Beckett program, which we'll talk more about later, covers children with medically advanced needs. So I wanted to walk through the different Medicaid programs and kind of break down what these programs do and who they're for and who they support. So home and community-based service waivers. There's several different kinds of these waivers, but it's important to note that what these waivers do is provide financial assistance to folks who are seeking to age in place and not go into an institutional setting. And what that means is being able to stay in their homes with their family members, being able to go to adult day programs where they're with other folks who are elderly, and really have that continuous interaction and really feel like they're a part of the community. So we see the comp waiver, the new options waiver. So this provides home residential support and supervision. So it's for folks who need less intensive care and urgent needs, and for folks who have more advanced needs as well. So you think about nurses or other medical professionals going into a home, helping with medications, helping with bathing, helping that person that maybe has more advanced needs get through the day. And then we have folks that go into homes and do some light support work, like maybe doing some meal preparation or some light cleaning, and just providing that support to elderly folks who are seeking to stay at home and age there. I had the opportunity of going to Rosswood's Adult Day Center earlier this year, and I met Miss Sherry, who graciously spoke to me, even though she was doing arts and crafts at the time. And she has home and community-based service waiver, and as someone who lives by herself and needs help getting to and from the center as well as to her doctor's appointments, having this waiver allows her to access those services and get transportation where she needs to go. This is also for frail adults, for disabled adults. It really helps those Medicaid recipients with physical disabilities, like Miss Sherry, who want to live in community, who want to be around other adults and folks their age during the day, and feel connected and engaged. These different Medicaid home and community-based service waivers really help to ensure that that happens for elderly folks here in our state. And now we're going to talk a bit about children. We know that half of all Georgia's children are covered by Medicaid programs. And so the GAP program, which is the Georgia Pediatric Program, serves children who are under the age of 21 who have medically advanced needs and helps with nursing care and other medically necessary personal care support. So just like older folks who were frail or lived with disabilities, who have folks come into their house and provide that advanced medical care, the GAP program does the same thing but for children. And then we have the Katie Beckett waiver, which I mentioned earlier as well. And this allows children with disabilities to receive care regardless of their parental income. We saw the financial requirements for folks to get on the Medicaid program, and the Katie Beckett waiver can help parents who have children with very advanced needs receive help regardless of what their income is. And this is a quick story, not from Georgia, but the New York Times did publish a story about a woman who had a son with medically advanced needs. And as she was trying to navigate the different care systems and different medical support programs, it seemed like she was not going to be able to get help due to her income. And then because of the Katie Beckett waiver, building on top of those, on top of the insurance that she already had for her and her son, she was able to provide care, in-home care for her son, and also continue working so she could continue to support her son as well. So we can definitely see the benefits and importance of the Katie Beckett waiver and supporting medically fragile children. So just to talk a bit more about the supports provided to children through the Medicaid program, Medicaid does cover over 1 million children in the state of Georgia, and then Peach Care will build on top of the Medicaid program, protect even more children, provide even more support. And it's really important to note that Medicaid does cover 100% of current and former foster care children up until the age of 26, regardless of what state they live in. And right now in the state of Georgia, there's approximately 28,000 children, current or former foster children, that are covered by the Medicaid program. And so there are also a lot of important resources that children are able to access through the Medicaid program. So we think about early periodic screening, diagnosis, and testing. This includes screening, vision, dental, hearing, treatment. It's really important to provide these screenings early on for children, so doctors will be able to catch any issues before they get chronic or really serious. And the Medicaid program allows for these services and these screenings to happen for children early on. And it's really convenient to have Medicaid in school systems. This is a place where children are already going, where their parents tend to have a close and supportive relationship with school administration, and there's trust there as well. And low-income parents can be connected to Medicaid resources, maybe that they didn't know about before, but it also serves as an information hub when we have Medicaid in school systems to support children there. We had a story about a family who had not one but two children with very advanced medical needs, and they speak briefly about having just astronomical hospital bills, right, to take care of these children, and not being a sustainable way to manage their care. And so with the Katie Beckett waiver, these parents having full-time jobs are also able to have that additional support to provide that in-home care to their children. And we can see the importance again of what Medicaid does for children in Georgia through the Vickers family. So we're going to talk a bit about folks living with disabilities and what that means as far as the Medicaid program goes. Medicaid is the primary payer for a lot of necessary services and supports for folks living with disabilities. It includes nursing home care, home and community-based services, what we spoke about earlier with folks coming into homes and providing support, or elderly folks being able to go to day programs. And even further, Medicaid will also pay for wheelchairs, lifts, and other supportive housing services. So when we think of supporting folks living with disabilities, we also have to think about transportation, right? And so having those wheelchairs and lifts paid for allows for folks living with disabilities to get around easier and access the services that they need. Medicaid also helps people with disabilities find and keep jobs. So we think about skills assessment, job search and placement, and then job training. So we want to teach folks how to search for different jobs, make sure they have those skills that they'll need to perform their jobs well. And so Medicaid does provide that support for folks living with disabilities as well. Again, during story collection, earlier this year I had the privilege of meeting Travis, who also works at Disability Link. We started volunteering there several years back because he wanted to be connected to community. He wanted to help empower others and connect them to services. And since he's been hired as a full-time staff member, and when I spoke with Travis, he attributed Medicaid to being one of the main reasons why he's able to be consistent and have a job that fulfills him and also allows him to give back to community members, right? So as a person living with a disability, supporting folks living with disabilities, it's really impactful to see how the Medicaid program supports him in that. Medicaid also supports seniors. So we have over 185,000 seniors in Georgia that are covered by the Medicaid program. So when we think about nursing home and long-term care for seniors, it's also provided by Medicaid, and providing services to allow seniors to age in place. This helps folks be able to stay with their families, be around folks they trust and know, and not have to be in an institutional setting if they don't choose to be. Next, a really important part of the Medicaid program is supporting pregnant people and newborns. So if Medicaid covers half of all children in the state of Georgia, it also covers half of all births in the state of Georgia. Provides comprehensive care for people while they're pregnant, and this is up to 60 days after they deliver their child, that they're still receiving services through the Medicaid program. And we know that prenatal care is very important and necessary in ensuring that we have healthy children, being able to do interventions if necessary and screenings, etc. The Medicaid program also provides these services for people who are pregnant as well. Again, half of all births covered in the state of Georgia, and so we see that it's really important to provide the support for young parents during pregnancy and then afterwards, to ensure that babies continue to be healthy. And ensuring that babies are healthy, it's really interesting to look at the rate in which folks go to their healthy baby checkups, folks covered by Medicaid and then by private insurance. We see that there's only a 1% difference in private insurance and Medicaid rates of going for that well child checkup in the last year. So we see that Medicaid is very comparable to private insurance, and that it also supports the development of healthy babies as well after they're born. And now we're going to talk a bit about an economic case for Medicaid, why Medicaid makes fiscal sense, and what this looks like in the state of Georgia. So Medicaid gives Georgia a 2-to-1 return. That means when Georgia invests $1 into the Medicaid program, get that back double, right? And so we can see that this is a good investment with double the return. And there's often a lot of conversation about the efficiency of Medicaid and where these dollars go. And we've seen that Medicaid does control costs, and 94 cents for each dollar spent on Medicaid goes directly to health services, and the other 6 cents of that dollar is spent on administrative costs. So we can see that almost all of every dollar that's spent on Medicaid goes to ensuring that folks receive the health services that they need. And this is a really important note about the Medicaid program and about costs. And so along the lines of controlling costs, we compared Medicaid with private health insurance and the amount of modest growth per enrollee. So we see that Medicaid is at 1.1%, private health insurance is at 4.4%. So that shows that cost stays fairly consistent, more consistent than private health insurance actually for the Medicaid program. So consumers aren't dealing with large increases in their services through Medicaid from year to year. So that's also important to note, that there's consistent growth per enrollee, and this allows Medicaid to ultimately control costs of these services that folks are accessing. So Medicaid also protects consumers in economic downturns. We see that if we think about the impact of the 2001 recession, we see that that is the highest amount of Medicaid participants. And as time goes on, and we see that we're coming out of that 2001 recession, we see participation rates go down. And then they're significantly down when the economy is stable and then there's jobs. We see folks working in their communities, getting health insurance through their jobs as well, or through the marketplace as they have more economic means to do so. And then we see again with the impact of the Great Recession that those participation rates will increase when there's less job security and when the economy is less stable. So Medicaid responds to those economic downturns, and we can see that with the participation rates here. So what's next for Medicaid? We know who Medicaid supports, why it's important. So what can we look to happen to Medicaid in the near future? Well, Georgia has a great opportunity to expand the Medicaid program and choose a way to best for our state. So thinking about different interests like education and transportation, really taking all that into account, and then figuring out where Medicaid expansion goes from there. And again, I want to mention that this happens when our governor and our Georgia legislature come together to agree to expand Medicaid for our state. And this will directly impact about 240,000 people who are currently uninsured, who could be if we expand Medicaid. So again, wanting to remember the importance and the numbers of folks who would be able to benefit from this decision in the future. I also wanted to talk a bit about the bureaucratic red tape around Medicaid expansion. We have a chart here that shows the work status and the reason for folks who are not working, and this doesn't include SSI folks. And this is a report from 2016. So we can see that at 43%, we have full-time folks on the Medicaid program. So people who have full-time jobs, who are going to work. We see that this isn't an issue for people who don't want to work. We see this very clearly. We see 18% folks working part-time, 14% of folks not working due to illness or disability, a small percentage not working due to being students, caregivers, and then only 7% of all folks in the Medicaid program reported didn't have a reason for not working. So we see that the vast majority of folks who are able to work on the Medicaid program are doing just that. And so we want to be mindful of what this means, what the implications of this this is. So thinking about establishing systems that would require folks to report their hours and make their health insurance dependent on those hours completed. This is a way that we've seen folks lose their coverage, and we want to always be mindful of what the implications of that could be, because we do want folks, as many people as possible, to receive this coverage and not necessarily make that dependent upon hours out in the field. So it's definitely something that we want to be mindful of as we move forward and we look at what is coming for the state of Georgia. And then Georgia's legislative process. So as I mentioned at the very beginning of the video, GHF is very active during the legislative session, and we also teach consumers a lot about the legislative process and also how they can get involved. And so we have some slides here that really detail the entire process of a bill being passed in the Georgia legislature. And so essentially, when a legislator has an idea and wants that to become a bill, this legislator goes through a different process in putting this bill forward. And what's most important to note is that consumers, everyday consumers, have a part to play in this, are able to see what these bills are, determine how this will impact them in their communities, and also have a say, right, in what bills are being passed and what bills are being looked at. And this is what we want to encourage consumers to do. We want to encourage folks to look at these bills, to join us at the Capitol, to let us set up meetings for them, and then really engage in the process. And that looks a few different ways. There's lots of different advocacy opportunities within the legislative process. So there's always committee hearings and votes. Folks are able to submit comments and provide testimony, and this can be regarding bills, how folks feel that these proposed bills will affect communities. There's floor debates and votes. You're always able to contact your legislators. All that information is public. You can always reach out and really connect directly with the folks that are down in the Capitol passing legislation. Again, advocacy opportunities look really different in and out of the legislative process. Last year during the legislative session, well, this past year, excuse me, during the legislative session, GHF held a Cover Georgia Day at the Capitol. And Cover Georgia is one of our working coalitions with different organizations who are all invested in Medicaid expansion. So we had over 100 advocates there at the Capitol, right? We had people who work in health advocacy, providers, we had community members, and we had several speakers talk about why health insurance and access to health insurance is really important for folks in our state. We have folks talk about behavioral health issues, cancer, a few other things as well. And that really brought together a lot of people over a lot of different interests, and we were able to connect folks directly with their legislators and have just face-to-face conversations with legislators that day and really talk about health insurance and health access issues that were important to them. So there's a few other advocacy opportunities. You can always talk to your legislator about issues that are most important to you. Sharing your healthcare story. There's always through GHF, we are looking for folks to talk about their healthcare story, talk about barriers or any other issues so we can share that during our advocacy as well. Ask local media to cover the issue. Submitting op-eds or letters to the editor is always a good way to get your story and your opinion about different issues, healthcare issues out there for the public. And there's lots of different demonstrations or marches that happen, and this happens at the Capitol and all around the state when folks get together and they really talk about healthcare issues that are affecting their communities. And during an election year, it's always important to ask candidates about healthcare issues and vote for candidates that you feel are supportive of the issues that you want. We have resources, different questions to ask folks. If you need kind of an outline or support there, GHF will definitely provide that resource. And we really encourage folks to be as thoughtful and direct as possible in talking with these candidates before they take office. So, contacting your legislators. If you don't know who your legislator is, you can go through our website. It's healthyfutureGA.org. You go to the Get Involved tab, and then from there you go to Contact Your Legislator, and your legislator information will pop up. You can get their email address as well as their phone number. You can schedule an appointment at their office. You can get coffee with a small group, or you can go talk to them on the ropes, which is face-to-face across the velvet ropes at the Georgia Capitol. And GHF provides resources and support for folks who want to make appointments and who want to meet in small groups with their legislators. Phone and email is also a great way to reach legislators if you can't do it in person. We encourage folks to reach out to legislators when they do something great and maybe they supported a bill that was really important to you. And also if you want them to take a different action or to support you in something that you feel is beneficial to your community, we also encourage folks to reach out directly to the legislators under those circumstances as well. So you want to have a really concise statement when you talk to legislators. You want to say who you are, where you live, and why you're here or why you're contacting them. Why is this issue important to you? Before I speak to legislators, I always have that conversation with myself. Why is this healthcare issue important to me? Why am I going to the Capitol to talk to legislators, right? I want to have that information already in mind when I go. The ask, what do you want your legislator to do, right? So at the end of the conversation, when you've explained who you are, where you're from, and why you're there, you want to ask them to maybe to support a bill, or maybe to take a different action that you feel would benefit yourself or your community. You always want to have that action item at the end. You want to have that ask. So this is, again, in order to contact your legislator. If you don't know it off the top of your head, which many folks don't, you can always go to healthyfutureGA.org through the Get Involved tab, participate, contact your legislator. You're going to enter your contact info, and then you'll be directed to write a short message about why Medicaid is important to you and important to the state of Georgia. So this is a really easy way to get in contact with your legislator. We have a few advocacy resources. We have the Georgia Council on Developmental Disabilities, the Georgia General Assembly. That's a website we go to often during legislative session to which bills are being moved along and what we should watch for. Georgia Health News also provides a lot of important updates about different health issues in the state of Georgia. You can always follow us on Facebook and Twitter at Healthy Future GA. today, and look for our events and attend those as well. And then these are some of the advocacy resources that we have available. Again, we have another advocacy resource, the Georgia Health Advocates Network. It's actually the Georgia Health Action Network, excuse me. And so this is when we bring together members from communities and we talk about different advocacy opportunities and how folks can create those opportunities where they live within their communities, and so that can continue to happen and be sustainable. So if you're interested in learning how to be an advocate and want to take a more community-based approach to it, please contact us, contact me. I'll have my information here at the end, and you can shoot me a message if you're interested in joining us in that. So this is my contact information. Again, I'm Alyssa Green. I'm the Outreach and Education Manager at Georgians for a Healthy Future. Thank you so much for watching our webinar today. And if you have any questions or if you want to get involved in any of our advocacy work, please send us an email. My information is right here on the screen. Thank you so much, and I look forward to connecting with you in the future.